Double dipping at UnitedHealth. New fraud investigation. Basically looking at the company's practices for recording various different diagnoses that triggered extra payments to its Medicare Advantage plans. This also included physician groups that, again, this insurance company owns. Again, I for the life of me, I have no idea how they ever allowed that. You want to talk about a conflict of interest, and I know conflict of interest well because we've covered all the conflicts of interest on Wall Street. And there's a Chinese wall between investment banking and the sale. Bullshit. Okay, I don't know how this was allowed, but they did. There was a series of articles last year that showed that Medicare paid UnitedHealth billions of dollars for questionable diagnosis. Attorneys with the Justice Department, as recently as January 31st, interviewed medical providers named in the articles. In the Medicare Advantage system, insurers get lump sum payments from the federal government to oversee enrollees' Medicare benefits. When patients have certain diagnoses, the payments go up, creating an incentive to diagnose more diseases. Kind of like everybody's got COVID. Yeah. Everybody's got COVID. And, that's why you're in the high. And again, they made a lot more money based upon that. Again, this is the largest U.S. health insurer. They also have doctor practices, a large pharmacy benefit manager, and data and tech operating. I don't know what's going to come of it, but again, UnitedHealth came out swinging, criticizing the people that are looking into this. Would I be the slightest bit surprised that nefarious crap's going on? No. Listen, we used to have, again, healthcare in this country was great. Well, it had issues. We had our issues prior to Obamacare, but Obamacare really effed everything up. It really did. And again, we've talked about just the lack of doctors in certain areas. It's impossible. It's really difficult for them to get ahead or make any money. Talked about some of the conversations I've had with doctors. I'm going to go with a concierge service here where I am. It's where you have to go. The amount of money that I spend for my family of 5, insane. With the HSA, throw that in there as well. What we pay over the course of your HSA plus insurance. And again, this is, pretty good size deductible as well, well over $30-something thousand a year. We did it. We wrecked it, but it was by design. And, that's, Obama knew this. I've actually, basically come to grips with the fact that, we might have to have a single payer system here in the United States, if and only if they allow for people to have private insurance if you want out, if you don't want to be a part of it. I don't see any other way because, again, there's no way they're going to repeal Obamacare. I don't know how they would be able to pull that off. You take a look at the type of money that's being made off this, both Democrats and Republicans, all of these companies. Again, you're allowing insurance companies to have physicians. It's moronic. It was funny. I thought about it the other day. There was the first installment with Eddie Murphy. Remember Dr. Dolittle there? He could talk to the animals. And in the first Dr. Dolittle with Eddie Murphy, I remember it was he and his partner were being approached to buy their veterinary practice. and having it rolled in with some major corporation. And he was going to do it. And then I try to remember exactly, but then he kind of figured out what he was dealing with and he changed his mind. And we did this to ourselves. WatchDog on wallstreet.com.